I'm Ernesto De Castro, 46 years old, and I am the former lead guitarist of a band called Black Swan.
Kamusta ka na?
Okay lang naman. Jake.
Anong pinagkakaabalahan mo ngayon?
Actually, parang normal na lang buhay ko ngayon eh. Tapos, ayun, pamilya na lang, iniisip ko, hindi na din ako nakatugtog.
Pwede bang ikwento mo sa amin yung buhay mo noon? Nung nagbabanda ka pa?
That was my golden years kasi yun yung time na, kabataan, nagagawa ko yung gusto ko sa buhay, nakakatugtog ako, and nakapag-travel, nagagawa ko yung gusto ko, nakapag-bisyo ko, nakapag-inom, nakapag-party.
Bakit ka pala tumigil sa pagigitara?
December 10, 2005, meron kaming gig sa bahay. And then, bigla na lang sumakit yung daliri ko and hindi ako makapag-play.
Ikaw?
And after 3 weeks, dun na lumala yung simptomas. At dun na nagtapos yung pagbabanda ko.
Ano pong pangalan nyo?
Ako po si Stephanie De Castro.
Kaano-ano nyo po si Ernesto?
Kuya ko po siya.
Pwede bang maikwento nyo sa amin yung mga napapansin yung pagbabago sa kanya?
Simula po nung pagkatapos po niyang magbanda, may kakaiba na po akong nakikita sa kanya, parang sa kilos niya po. Madalas po na reklamo niya sa akin, sumasakit po yung kamay niya.
Paano naman yung mga gawain niya dito sa bahay? May nagbago ba?
Yun nga po, napapansin ko din po na madalas po siya nakakabasag ng baso. Tapos para po, ang dami po niyang gustong hawakan na hindi po niya, parang akala po niya nahawakan pero hindi naman po pala.
Meron pa po ba sa pamilya niyo yung may ganitong sakit?
Opo,
Sino?
si mama po.
Ano nangyari kay mama mo?
Simula po nung tumigil din po siya sa pagtitinda dahil po sa rayuma din po. Parehas lang po sila ni kuya na sumasakit po yung kamay. Ganun po na nag-deform, nagbabangking-bangking po yung mga daliri po niya. Ganun po. At hindi rin po makapaglakad dahil sa arthritis.
Several assessment findings are associated with rheumatoid arthritis, rheumatoid nodules, joint inflammation detected on palpation, and certain laboratory findings. The history and physical examination focus on manifestations such as bilateral and symmetric stiffness, tenderness, swelling, and temperature changes on joints. To evaluate disease activity, help guide treatment decisions, and monitor treatment efficacy, symptoms and examination findings are frequently recorded using a disease activity score, of which there are several. The CBC should be checked to establish a baseline count, particularly before starting medications. Most DMARD therapy includes liver and kidney monitoring because it can cause an increase in liver enzymes and it affect kidney function. Plain X-ray is the most commonly used radiographic study to track disease progression because it is inexpensive, dependable, and reproducible. Small erosions that are not visible on X-ray or ultrasound can also be detected using MRI.
Mr. De Castro, bibigyan kita ng prescription ng gamot mo later. Bibigyan kita ng pain reliever para mabawasan yung pain na nararamdaman mo. Hindi mo na need i-admit. And nandito yung mga nurses, sila yung mag-explain sa'yo kung ano yung mga dapat mong iwasan at mga dapat mong gawin.
Good morning, sir. Para po hindi na po ma-trigger yung sakit nyo, dapat nyo pong iwasan ng kumain ng beans o putahe na may munggo, pagkain ng matatabang pagkain, at iwasan nyo na rin po ang mga bisyo nyo tulad ng pag-inom ng alcohol at pagsisigarilyo.
Yes, sir, pataas naman ako ng kamay nyo. Yung exercise po natin sa bahay, ganito po ginagawa. Ganyan, 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 ganyan. Tapos gumamit na lang po tayo ng stress ball para po ma-exercise po yung kamay natin. Ay po, thank you po.
Salamat.
Ingat po sa pag-uwi.
Sige po, salamat.
Rheumatoid arthritis is an autoimmune disease where a person's immune system attacks and targets the healthy connective tissues surrounding joints in our body. So how exactly does it happen? In our body, we have natural collagen type 2, made up of chains of amino acids like glutamine, arginine, glycine, and proline. Unfortunately, some genetic factors, bacterial or viral infection, or smoking can induce mutation in the collagen type 2. This mutation results in replacement of arginine amino acid into citrulline amino acid. This little change has devastating lifelong consequences on the affected people. The antigen-presenting cells, or APCs, such as dendritic cells, which patrol our tissues, recognize this new mutated collagen. These antigen-presenting cells have specific detecting molecules on their outer surface membranes, called HLA molecules. Specific types of these HLA molecules are HLA-DR1 and HLA-DR4. They become confused and deal with the new collagen as foreign bodies. As a result, the antigen-presenting cells phagocyte this new collagen. After digesting the citrullinated collagens, the APCs present some parts of the protein on their outer surface as foreign bodies. On the other hand, T helper cells in our body works as security detectors who search all antigen-presenting cells of any suspicious foreign bodies. Once T helper CD4 cells meet with the antigen-presenting cells, they connect to the citrullinated collagen and become activated. This activation results in production and release of cytokines IL-2, which have an autocrine effect as they come back to bind and activate the releasing T helper cells. IL-2 induces T helper cell proliferation into two cellular lines. These are T helper 1 abbreviated as Th1 and T helper 2 abbreviated as Th2. The Th2 stimulate the production of various antibodies, whereas Th1 are directed towards cell-mediated immunity. The first type of antibody is the IgG antibodies. These anti-CCP antibodies, the second type of antibody are the IgM antibodies, for diagnosis of which attack the altered IgG antibodies. So there is now an antibody against our own antibody. They are called rheumatoid factor and they are very common in serum of patients with rheumatoid arthritis. Now both antibodies travel through blood to the joints and even to other tissues. Remember, rheumatoid arthritis is a joint disease with systemic manifestation. Now let's focus on the joints where antibody complexes accumulate. Accumulation of antibody complexes activates phagocytes and the complement system. The activated phagocytes release inflammatory cytokines such as TNF-alpha, which play an important role in mediating the inflammatory damage of the joints. They also secrete IL-1 and IL-6. This cytokines stimulates the synovial membrane proliferation swelling, which is a remarkable pathologic sign of rheumatoid arthritis. Additionally, they activate osteoclast cells, which induce bone erosions. Angiogenesis is also stimulated by the cytokines. On the other hand, the complement system activates the neutrophils in the synovial fluid. Together, cytokines release for activated macrophages and activated neutrophils induce the production of protease and collagenase enzymes, which progressively erode and destroy the castor layers of our joints. This causes inflammation of joints. Patients experience swollen, stiff, and painful joints. Symptoms are worse in the morning and after periods of inactivity. The most common joints affected are the small joints of the hands, feet, and ankles.
Rheumatoid arthritis is one of the most prevalent, more prominent, and it is a very large public health issue among the elderly. Arthritis may cause limitations to a person's life, just like Mr. Ernesto's. So the onset of this condition may be acute or insidious, with a course possibly marked by periods of remission, a period when disease symptoms are reduced or absent, and exacerbation, a period when symptoms occur or increase. So, treatment can be simple. It can be aimed at localized relief, or it can be complex, directed toward relief of systemic effects. So, permanent changes and disability may be a result. A hallmark of inflammatory rheumatoid disease is autoimmunity, where the body mistakenly recognizes its own tissue as a foreign antigen. Autoimmunity leads to the destruction of tissues via the same inflammatory process as discussed earlier, along with chronic and long-standing pain. Although rheumatoid arthritis is focused in the joints. So its clinical manifestations are mostly joint swelling, limited movement, stiffness, weakness, and fatigue. So we have seen how patient with rheumatoid arthritis is being assessed, and the physical examination was performed by Dr. Shanley. So the diagnostic tests are X-ray, CT scan, MRI, and arthrography. So its medical management is most likely the partnership of the patient and of the health worker. And being aware of their condition is very important. In short, health education should be conducted to our patients. So, pharmacologically speaking, we should give them NSAIDs. So, non-steroidal anti-inflammatory drugs are given. And disease-modifying anti-rheumatic drugs also to suppress the autoimmune response of our body. So, non-pharmacological treatments include heat or hot compress.
Maikli lang ang buhay, sabi nila. Kaya, bakit mo pa babawasan? Live healthy so you can do the things that you want. Hiram lang ang buhay. Kaya dapat talagahan.
Stream down your face.